So Dr. Rishi is presenting on novel push and invert technique for soft cataracts.
Thank you. At the outset, I'd like to thank the local organizers and AIOs for the opportunity. So this is a very simple technique, and I'm sure all of you will find it useful if you tend to struggle with soft cataracts. So, you know, we all have some problems with soft cataracts. When you're trying to emulsify them, they tend to, you know, get cheese wire. If you're trying to get a grip, often you end up creating a crater, and you don't get a purchase to emulsify the nuclear material. And if you keep chasing it, sometimes you can end up catching the capsule, you can injure it, and sometimes the case takes longer than you would like to. So to circumvent this problem, people use some techniques like prolapsing the nucleus with either viscoelastic or hydrodissecting it out of the capsular bag, and then completing the rest of your procedure with an IA probe, etc. Or you just be at it and continue chasing it with the phaco probe using aspiration. But while I used to do all these, I kind of stumbled upon this technique, which I now modified from what I used to do, and I found that this works almost every time in soft cataracts. So I've given it the name of push and invert technique, and I'm sure many of you may already be using it, but nobody has described it, so let's see. So what we're doing in this basically is you're going into the depth. So once you've divided your nucleus into two heminuclei, you're going into the depth of your nucleus, and at the bottom half, closer to what would be a posterior plate, is where you would give a kind of lateral pressure. And as you press this nucleus, it actually rolls against the fornix of the bag. The animation is not great, I made it myself, but basically what it does is, because the fornix of the bag is round and your nucleus is round, it rolls against it as you apply lateral pressure, and it actually prolapses, and the equator of the nucleus actually comes up, and then you can emulsify it from there. So I'll just show you a couple of videos how that works. So in this case, we tried to do phacoemulsification, but it was cheese wiring, and then using a visco cannula, and you can also inject visco as you do this. You see, I applied some pressure and the whole thing rolled up. I'll show you more videos too. And then you basically grab the equator and emulsify it from that end. So this works very well actually. Even for regular cataracts you could use it, but you don't really need to for grade 2 onwards. But for soft cataracts particularly, I think it's really useful, and you don't really need to struggle getting that nuclear piece or whatever it is out of the capsular bag, and to get a purchase for emulsifying. So just to demonstrate again, so if you're trying to do it with a phaco probe type of an instrument, it won't happen because it's too thick, and you don't really get that posterior pressure that you want. So you see now I'm doing it with the Sinskey hook, or you could use a spatula, and the irrigation is on, and it just rolls against the fornix of the bag, and it comes out, and you then grab the equator and emulsify it. So it works every time. I mean, this is my go-to now, when anytime, even if the vacuum is not great, if I'm using not a very great phaco machine also, I just do this and it works almost every time. So you can just see the other side. Again, I'm just, for purpose of demonstration, I'm showing you, I'm trying with the phaco probe, it doesn't work. And then you try with the Sinskey hook, which I'm using now, and it rolls against the fornix and comes out. So it's very good, and I think it's very easy for any surgeon. So the key is to be in the posterior half of the nucleus and apply gentle lateral pressure. Don't worry, you won't cause zonal dialysis, because it's round and the nucleus is round, it will roll. And this is just a case of a femtosecond laser where the 4 cuts have been made, and just visco is being used to separate, and with the same cannula, I just turn the piece out, and then you can just emulsify it the same way. So essentially that's it, a useful technique to tackle soft cataracts. For very soft cataracts, you can use a OVD cannula and inject OVD as you're doing this, because otherwise if you just use like a Sinskey hook, it may cheese wire again. And for grade 1, 2, you could use a spatula, a Sinskey hook with the irrigation on in your phaco probe, or you can again use a cannula if you like. That's about it. Thank you.
Nice, very nice, Rishi. It looks so like intuitive. Anyway, I was wondering, why do you say that the phaco tip does not work? Because, you know, I felt...
No, it would work, but you have to be at it. You have to be at the exact posterior part of the nucleus, and, you know, because it's a big instrument, it's not as easy. Yeah. It would work, but you have to be at the absolute posterior end of...
So what you are recommending is use a chopper or something, or a dialer?
Not a chop, something blunt. So okay. Since you
a white-tipped cannula, white-tipped...
white-tipped cannula would work beautifully, yes. Yeah. Or Herschel's cannula.
Right, Herschel.
The visco cannula. that would work very nice.
Right. You've given an idea to him now.
Yes. Thank you.
Thank you so much. Any other question? Ashish or sir?
Just a basic question, that what the IOP in the anti-age chamber at that time, we shouldn't fill it with visco or anything, if you're using not the phaco probe or not a irrigator.
I don't think it makes so much of a difference.
Does it matter?
Yeah, but in general you never want to hyperinflate the AC for any step of phacoemulsification.
So that would be important, not to hyperinflate.
Slightly softish, okay. So that it
does
won't
it
push it back.
It doesn't push back.
Does it happen equally easily? You showed it even in a heminucleus.
Yeah.
So does it work in a particular size of a
in
fragment?
quadrants? No. So I use it for quadrants also sometimes. So if something's stuck, you've created a crater, just roll it out.
Pretty good.
It works.
Thank you.